And welcome back. It's still the first hour here for a Tuesday edition of Wake Up Nigeria. And on our health segment today, we'll be discussing glaucoma, which is something everybody wants to know about. In fact, it's called the thief of sight. Now, joining me in the studio today is Dr. Okpare Collins, an alumnus of the University of Benin. He is a clinical research optometrist with an extensive scope of work that has seen him practice across geographical zones. You are welcome, Mr. Okpare.
Thanks so much.
Did I get that right? Are you from Benin?
No, I'm from Delta.
Delta status, either one or the other. That's nice. Good to have you here.
My pleasure.
I've had my experience with doctors, optometrists about the subject of glaucoma. They've impressed it on me that once you're past 40, you need to get checks. And these checks are, I wouldn't say lugubrious, but they are very specific kinds of tests, the pressure tests and all of that. But first, let's start from a doctor to a layman in describing or defining what glaucoma exactly is.
Okay, thank you very much. I think it's very key. Let's use the layman definition to be able to carry people along. So glaucoma is actually a condition that simply affects the back of your eyes.
The back?
Yeah, the posterior portion of your eyes.
Okay.
All right, so there is this connection between the eye and the brain. Mm-hmm. So images that are seen by the eyes, of course, are related to the brain for interpretation. And this channel is what glaucoma actually targets. So severing the connection between the eyes and the brain. So consequently, you have an eye that is open but doesn't see. So that's simply what glaucoma is. Something that just affects the posterior portion of the eyes, the back of the eye specifically.
Okay, so this results in blindness, and it's not a sudden thing. It's the reason why it's called the thief of time. It's like it creeps up on you.
Yes.
So exactly what process goes on while it's creeping up on you?
That's actually very tricky. Because most times, the reason why it's actually referred to as the silent thief of sight,
thief of sight,
is because you do not, there is no active process going on that you are aware of as a patient. So as a matter of fact, there are no symptoms for glaucoma. Basically what you have are signs.
Okay.
Yeah, so, and it's actually very important to distinguish between both of them. So there are signs, there are symptoms. Symptoms, we're talking about what the patient observes, what the patient notices, you know, redness and all of that, those are symptoms. Okay. But then signs are the things that the doctor would have to look into the eyes and observe. So for example, if you look into the patient's eyes and then you're observing some glaucomatous changes.
What are these changes? What are these signs exactly?
That's the thing. There are no symptoms. So you just have signs. And if I have to go into the signs, I don't think I'll be able to carry you along.
As a layperson, yeah, I get you.
So there is actually an anatomical structure at the back of the eyes that is referred to as the optic nerve head. Okay. All right. So this is clinically what optometrists or doctors have to look, have to examine in the process to give a diagnosis.
So while you've noted that there are no signs, what would the patient be experiencing, however, that could be a indication?
It's annoying. The patient doesn't experience anything. There is no redness, there is no pain, there is no itching, but then vision gradually deteriorates. From the periphery,
so
actually.
If this, for instance, was, well, I can actually see the plant and some of the books.
Exactly.
So am I healthy, first of all? I know that's not a good diagnosis. But are you saying that my vision slowly narrows?
That's exactly how glaucoma affects your vision. So a lot of people actually have this misconception that, oh, I can see something so far away.
I'm good.
Yeah, so I'm actually good. Whereas glaucoma doesn't typically affect how far you can see, but then how wide you can see. So it gradually creeps your vision, from the periphery until eventually all you have is just a tunnel vision. You're just able to look straight ahead, and every other thing around is actually
that's going to affect your life.
And that's actually a very good example. I think you've done a lot of research on glaucoma.
Well, like I said, yes, indeed, I have had plenty of talk with doctors.
While at home, I think we should even encourage patients to do that. While at home, you just stretch out your arms, and then while looking straight ahead, I'm not looking at my hands, but I can actually see my hands. Do you get? But for some persons, they'll have to tilt the head a little bit before they notice something in their... Okay, that's actually too far back.
No, but I can actually still see my hands.
Okay, great. So you have very awesome field of vision.
Yeah, Mike, can you see your hands when you do that? If you're not too focused on the food.
So you should actually do that, once in a while. But that's not enough to actually make a clinical diagnosis of glaucoma. It is just an at-home attempt, of finding out things or of getting interested in your visual health.
Oh, wow, very interesting. Now, I'm going to go on and ask what causes it exactly. Are there habits or lifestyle choices that could cause glaucoma?
Yes, there are. Of course, there are risk factors to developing glaucoma. One of them is age. Older people are more at risk of developing glaucoma above the age of 40, but it doesn't therefore limit glaucoma to only older people. Of course, there are congenital cases of glaucoma, that children who are born with glaucoma, for example. Yes, you have juvenile onset, you have juvenile onset of glaucoma and all of that. So it's not really an age something per se, but then age is a risk factor. Of course, high blood pressure is also another risk factor. Okay. Patients who are hypertensive, patients who are diabetic, you know, all of those are actually risk factors. And then there's something we call the intraocular pressure. It's just the same way you have the blood pressure, you know, for general systemic. So you also have the intraocular pressure for your eyes. And this is actually very key. It's actually one of the highest risk factors. So the standard, just like we have the blood pressure, 120 over 80 millimeters of mercury, we also have a range of pressures for your eyes. You know, should be between 11 to 21 millimeters of mercury. So when you have your eye pressures higher than 21, over a period of time, that's actually a very high risk. You know, there's actually a very high risk of the person developing glaucoma. And then also a family history of glaucoma. That's actually very important. So nothing necessarily needs to be wrong with you, but the fact that probably your grandfather
had it,
your mother, you know, a first-degree relative, for example, a second-degree relative actually even has glaucoma, also increases the likelihood of the person getting glaucoma.
Lifestyle choices, before I go into my next question. For instance, if you smoke or drink plenty, that could also be a factor, yes? Now, to add to that, now what do I need to do or not do to reduce these risks?
Okay, yes, so lifestyle adjustments, of course. We're talking about lifestyle activities. We're talking about smoking, heavy consumption of alcohol and all of that. Those are risk factors to developing glaucoma as well. But it's important to note also that there's also the issue of susceptibility that we have to talk about. So the fact that we say smokers are liable to die young doesn't mean every smoker will die young. So there are some persons that, for example, would have a lifetime of smoking cigarettes and not get any form of issues with their liver, for example. There are some persons who will take just a few sticks and then we have them in the hospital. So susceptibility is actually key. Smoking, drinking, all of that, yes, but it doesn't mean, it's very important to note here, it doesn't mean that you smoke, you have glaucoma.
Real quick roundup and an advice for everyone, what to note about glaucoma, real quick.
I think generally what we have to note is just to be aware of ourselves, be aware of our medical history, as well as our family medical history.
Oh, fantastic. Well, thank you very much, Dr. Okpare. Very good that you're here. I'm hoping that you'll be back next week so that we can expand further
by the grace of God, of course.
Please do come back. Thank you very much. Now, do stay tuned. The kitchen is sizzling already.